the concept itself started off as All-On-4 and people refer to it, but really it's more now All-On-X or All-On whatever's needed to provide that solution. And we'll go through that during the interview. Cosmetic dentistry is the umbrella. So where this falls under, it can also fall under cosmetic dentistry. It's more aesthetic or cosmetic reconstructive dentistry. So like you said, cosmetic dentistry, we know it as whitening, veneers, bonding, crowns if necessary, and we try and reconstruct those as aesthetically as possible. There's many techniques. I'm an expert in the field of digital smile design. I use that. I speak a lot about that. So where this falls is, this is pretty much a lateral shift in that area, except you're applying all the principles of cosmetic dentistry, except you're using techniques to replace the lost teeth and also the lost bone. And there's many ways to do that. In particular, the All-On-4 technique allows the bridge work to restore the white aesthetics and the pink aesthetics. And shaping of the pink aesthetics is how we can reconstruct the areas of lost bony support, which obviously affect the face. And like you said, the most significant cause of aging in the face is the lower facial third, and this is our domain. And when you lose a dentition, or you've got what they call a terminal dentition, you're in serious trouble in that department, because you basically are losing total support in that area, and hence the significant collapse. This is why this procedure is so significant and is so important and amazing in what it can achieve if done correctly in such a short period of time.
I'm pretty sure most people haven't heard of anything to do with this. You know, we've got a level of familiarity with things like Invisalign, or we've got a level of familiarity with smile restoration, but this is
this is on a different level. There's slight variations. The protocol we follow is pretty much the most current concept and the most seamless. So we would do, like you said, the smile design, the prep work, take all the records, and it's videos, photographs, 3D scanning of the mouth, understanding where the final bite would be, because you're working with teeth that are collapsed. So we're not going to use the same collapsed position. So we design in a new ideal position. So all of that prep work takes a couple of weeks. Then at the time of surgery, we've got all our data. So at the time of surgery, you extract the teeth, all the teeth most times that are terminal. You're cleaning, shaving the bone so that all the infected bone is removed, along with the infected gum. That's all done in our clinic in our practice under general anesthetic. And that often takes, depending whether you're doing 1 or 2 arches and the complexity of the bone anatomy, anything from 3 to 5 hours. And so when the patient wakes up, everything is closed up, the implants are placed, the gums are stitched up, and we would have sent the records off during the surgery digitally. There's no molds taken anymore. All the data is captured using digital technology, which is amazing. So I will scan during surgery, and the data goes straight to my technician who's in another state. And so by the time the patient wakes up, they've already seen what I've done. They've got the data, and they will merge the existing implant position to the design that we had prepared prior. There's 2 aspects here. You're removing disease, any procedure, whether it's dental or medical. If you remove something diseased from an area, it's going to allow the body to heal. So the first step is removing the diseased teeth, whether it's rotten, decayed teeth or gum diseased teeth. So the first step is to remove that. The second step is to obviously replace it with something that's functional, that works, but you also got to maintain it. So if you've got someone that's predisposed to gum disease, and you're reducing that significantly by removing the diseased teeth and placing implants, you still got to be wary and obviously we discuss this with the patient. They still need to be committed to regular cleans and so forth. It doesn't mean they're bulletproof. So they can still be susceptible to peri-implant disease. And this is a really important point. Obviously, there's no sensitivity. It's much easier. We create a beautiful smile. But one of the key things in our initial discussions and consultations is the importance of maintenance. If you're not going to be maintaining your prosthesis and being committed to regular maintenance, we won't do the treatment. Because what's going to happen is you're going to waste a lot of money, because you're still you're going to have these teeth and all of a sudden develop gum disease around the implants. So that's something that is very important, not often talked about, but that's a big part of our maintenance and a big part of our initial discussions and treatment planning.
Well, I'd never had a conversation like that before, and I do appreciate it, because it's made me think about my teeth in the same way that I think about exercising. It's like,
Yeah.
how fit do I want my muscular and skeletal system to be? I want to have full range of motion. I want to be strong. I want to have great bone structure. And I never thought about my teeth like that. My teeth were just service providers, in my face, but I never thought about, okay, how are we planning for this? So that was a really interesting shift for me.
Yeah, well, that's a good analogy, because think of it in terms of exercise and what you said. So as you age, your exercise program changes, your needs change. So you're not doing the same. Well, I know I'm not doing the same stuff I was doing 5 years ago, let alone now. So your dental program needs to change accordingly as well and plan ahead. So like anything, you've got to plan accordingly. And one of the things that you've got to also think about, especially if you have a compromised dentition, you've got to make a call on certain things, because sometimes waiting too long, you get to the point when, you might be sick, or you might, God forbid, have the inability to have certain surgical procedures, say dentally, then all of a sudden you're stuck in a bind. So you're stuck with chronically diseased teeth because of medical issues, you can't move forward. So sometimes you've got to make a call, and I do this with patients where they put off treatment for a certain amount of time because we can. And then we have to make a call that, well, I think now it's time to pull the trigger, rather than wait another few years, because you're getting at that borderline where I don't know what's going to happen in the next 5 years, and if there's certain medical things that are going to stop you from having a general anesthetic or compromise what we can do. So then, sometimes you've got to pull the trigger earlier on certain things so that you could be set up for the next 10 or 15. So these are things, again, your dentist has to be thinking about these things, not just, knee-jerk stuff or just ad hoc treatment. You've got to really plan, and you can only plan if you understand what's available, have a really good innate understanding of the current dentition, and discuss, really express to the patient what your understanding of the long-term goals are, and your treatment plan, rather than wait for them to turn up on your door and say, okay, by the way, you need, top and bottom All-On-4. It's going to be this much, and we need to do it next week because, we've got severe infection. And the patients all these years, been coming along, having a clean, thinking everything's fine. And it happens a lot. I think word of mouth is important. You can go to all, you can go to, all these Insta pages, you can go to all these, look at all the reviews, but you don't know. You don't really know. I've seen pages where, some of the work was ours, as a before and after.
Yeah.
So you don't, yeah. It was like we did
Well, that's what all the
reimbursement.
APRA changes are. It's like the before and afters have
Yeah,
to be verified. They
yeah.
have to be correct. They've got to be
No,
yours.
no, that doesn't happen. I mean, that doesn't happen. Like I said, we found it was actually an all-on-4 case, and I recognise my cases even without the face. I know the teeth and I know the X-ray, and it was mine. And we actually contacted it. Oh, I didn't know. Oh, that must have been my web designer. I'm so sorry. I can't believe he did that. That's, so who would know? Patients would look at that. Go,